Life can be a pinch, believe me. From navigating romantic relationships, friendships, figuring out how to use the bathroom alone for once, mommies know the deal on this, to adjusting to all those changes because of this pandemic. Sometimes you just need to catch a break, and I'm right there with you. Hi, I'm Whitney B. Rochester, and this is the She Knows It podcast, a 30-minute sit-down and unwinding session to unravel your mind and your heart. If you're new here, welcome to this judgment-free space. If you're a returning listener, thanks so much for coming back. Follow me on Instagram at sheknowsit.podcast or sending your comments, feedback, or advice questions to sheknowsitpodcast@gmail.com. Let's get into it. Today, guys, is a very special episode for me because I realize that it's a very sensitive topic for a lot of females, especially the ones that are a part of the reproductive age group. So it's sensitive because when it comes down to Yoni care and personal hygiene, especially when it comes down to your love spot, as a lot of us call it, or the kitty, or the cookie, or the vagina, or the VJ, or the pum-pum, whatever it is you call it, we are going to be talking about it because many women go through bacterial vaginosis or yeast infection at least one time in their life. And based on the current trend, if you've been noticing, where the Yoni pearls and the boric acid suppositories and the vaginal steaming kits have become so popular, we want to talk about it, if it's safe to use all of those things, as well as to shed light on the practice of, as I said, vaginal steaming and care, and to outline best practices when it comes on to caring for your vagina. What is right? What is wrong? What is, indifferent? How do we care for it? Should we care for it? And I wouldn't be very happier to talk about it to anybody else than my good friend, who is a nurse by training and profession, Nurse Jaime-Lee Harris, who is also the diva behind Jamie's Skincare Essentials on Instagram. You can find her at skin_care_essentials_by_Jamie on Instagram for your skincare and hair repair needs. So guys, by standard definition, according to Britannica.com, in Hinduism, the Yoni is the symbol of the goddess Shakti. Let me get it right. Shakti, the feminine generative power. And then Wikipedia describes it as a Sanskrit word that has been interpreted to mean womb or female organs of generation. So we are going to be talking to Jaime-Lee Harris, RN. Put some respect on her name, please, and thank you. We're going to be talking to Jaime-Lee to get some insight into Yoni care, as I said, and what are the best practices. So hi, Jamie.
Hi, Whitney. How are you?
I'm wonderful. Thank you. Again, I said it to you off air, but I really want to thank you on behalf of myself and all the family for the sacrifice that you have made, as well as all other healthcare heroes on the front line, on the battlefield, trying to make sure that all of us are safe and healthy during this panorama, So thank you.
Thank you so much. That means a lot coming from you guys. And on behalf of all us frontline workers, you're welcome. And thank you for having me on your show.
It's a pleasure. So, nurse, the details, the business. We have been looking at Yoni care and by definition, what the Yoni is and how we care for it. But before we talk about all of those things, I want to find out what the Yoni is and what the vagina is, if there is really a difference between the two. Because when we were growing up, you done bathe and you come out of the bathroom, you girl, put on your towel, hide the vagina, hide it. You don't want nobody to see it. What is the vagina? Because a lot of us take it to mean that, it's just the front part, the outside part that has the pubic hairs. Enlighten us, please.
All right. So from what I've read or from what I know, The yoni and the vagina are slightly different, and I'll tell you the difference in a minute. But let me just explain what the vagina is. So the vagina is not only that outer part that you can see, which comprises of the part that has the hair, the clitoris, and the lips, but it also has the whole. It extends right up to the cervix. So the outer part as well as that hole, all of that is the vagina.
Okay.
As it pertains to the yoni, from what I've read or from what I know, the yoni not only comprises of the vagina, but it is all of the female reproductive system. So your womb, your vagina, your vulva, everything. That all of that is the yoni.
And it's so interesting because we hear the word being passed around. It's actually trending based on the yoni pearls, the yoni steaming oil, the vaginal steaming kit, the cookie cleanse, the what else? The boric acid suppositories. And many persons are concerned now as to the safety of using these things. And you know, oh, the vagina not supposed to smell so, and the vagina is supposed to smell like this. What is the vagina supposed to smell like? You know, right.
All right, so the vagina is not supposed to smell like roses, or the vagina is not supposed to have a sweet smell. The vagina is supposed to be have a fleshy smell or a tangy smell. So it's not supposed to be smelling sweet, and you're not supposed to be spraying any sweet smelling perfume down there for it to smell sweet. You know, that is a big misconception. And so the vagina is not supposed to be smelling sweet, although the odor varies from woman to woman, and the odor also vary from situation to situation, because a lot of things can affect the smell of our vagina. One being our menses. When you're on your menses, you know, you have that metallic smell or that smell of pennies. When you have had sex, you might get that metallic smell as well, and those two will go away. And you also might notice like a little fishy smell even after your period, or you know, when you start getting a little itch down there, because a lot of females either before or after the period might get a little touch of yeast. You know, that comes with that little fishy smell or that little itch. However, those should go away, you know, because of the hormone levels in the body. All of that can affect how much yeast is produced down there. But we're speaking about smell, right? When we get concerned about the smell of the vagina is when it starts smelling unbearably fishy. As you sit down and you open your foot, you smell the fishy. That's not supposed to happen. That can signify or signal that there is something going on down there. An infection is possibly brewing down there. So that's when we get concerned about the smell of the vagina, when it starts smelling stinky or fishy.
So do we now take matters into our own hands? Because a lot of us want to be doctors for ourselves or healthcare professionals for ourselves. Do we take matters into our own hands, as I said, by purchasing all of these? And you know, before I continue, let me just say that this is not to trump anybody's hustle. It's not to box food out of anybody's mouth. It's just for us to be enlightened on what the best practices are. So as it relates to taking matters into our own hands, do we use these things? Do we consult a gynecologist? How do we know, you know, what is safe from what isn't?
All right, so the vagina is a self-cleaning organ, right? Whatever is down there, if you're having an infection, the vagina is supposed to clean itself. So you might notice that you have a little discharge at the end of the day. That is natural. That's the vagina cleaning itself. Right? So if it is that you notice that the discharge is getting clumpy or cloudy or anything like that, I would recommend seeing a gynecologist. While there are home treatments that do work, you know, for persons, depending on the stage of the infection that you're having, you know, if it is that bad that the smell is unbearable and the itching is unbearable, then I would recommend seeing a gynecologist. However, with this trend of Yoni care products, they are not all bad.
Okay.
When it comes to the boric acid suppositories, I see nothing wrong with boric acid suppositories because they dissolve in the vagina. So it's just like when you go to the gynecologist and you get an insert, depending on what is happening with you or what kind of infection you're having, he will give you an insert. Boric acids are similar, right? The only thing I would caution against is the dose of the boric acid that you're inserting, right? As it pertains to the steaming, and let me just say, all of your organs are connected from your mouth right down to your vagina. So whatever it is that you're putting, you're inserting, or whatever it is that you're using to treat your vagina, it should be safe for all of the organs in your body. All right?
Okay.
So as it pertains to steaming, what I would do is research the contents of your steamer and see if it is safe for your body. If it is, if you are satisfied, then go right ahead. I don't see anything wrong with the steamer and the boric acid suppositories. I don't see anything wrong with the kitty wash and the kitty oil, especially if you're using it properly. You're not supposed to be squeezing the oil up inside or spraying the wash up inside. No, it is for cleansing the outer parts of the vagina. The pearls, on the other hand, is not something that will dissolve. I would not recommend the pearls because the recommended use of it is that it is inserted and it stays there for 3 days to pull out whatever toxins are in your reproductive system.
Okay.
Right? So there should not be anything inserted in your vagina to stay for 3 days. You run the risk of putting your body into toxic shock. You run the risk of giving yourself toxic shock syndrome. And this happens when there is a foreign body, when there's bacteria in your body, and the body is trying to get rid of it, and it cannot get rid of it. Right? So you run the risk of doing that with the pearls. So for me, personally, I would not recommend the pearls.
We'll have to pause here for a commercial break, but we'll get right back into it and how we can, now that we know the dangers of using the Yoni pearls as opposed to boric acid suppositories and those things, we want to know now, okay, how do we naturally, or what can we do to naturally take care or practice proper hygiene where our vaginas are concerned?
This segment is brought to you by Jaime Skincare Essentials, your one-stop shop for all you need to repair damaged skin, hair, and nails. Choose from a wide variety of exfoliating and moisturizing soap bars and scrubs to hair growth oils and nail vitamin supplements. A sweet treat for you! Take 10% off your order between April 28th and May 4 when you use the discount code SheKnows10. Find her on Instagram at skin_care_essentials_by_Jamie or call 1-876-504-4035.
So guys, we're back again, and if you're just joining us, welcome to our Yoni Care talk. It's very sensitive for a lot of us because, if you're carrying a smell sometimes, especially in the workplace, or if you're amongst a group of people, sometimes you don't necessarily notice right away, and somebody might be there and they tell you and you feel offended, but you don't have to feel offended here. We are here to dispel the rumors, to dispel all the fears, and get right into how we can naturally care for our vaginas. If it is that you have any questions, you can always shoot it over to me at sheknowsitpodcast@gmail.com, or we can continue the conversation on my Instagram page, sheknowsit.podcast, where you can let me know your questions, let me know your concerns. You can also send me feedback, as well as what we can talk about next time, because this is our little community, our girl chat sessions every Tuesday at 5 p.m. So, nurse, We talked about what the yoni is. We talked about where we find it. We talked about the different products that are out there on the market and what the benefits, the pros, the cons, the ups, the downs are with each of them. But now we want to find out how do we naturally care for our love spot? I call it my love spot because it's the love, the love spot. How do we naturally care for it? What can we be eating? Should we be changing our diet? Should we be drinking more water? What do we do to naturally care for it so that we don't have to go to using self-medicating then, as I should say?
Okay, so to care for a vagina, as I said before, the vagina is a self-cleaning organ, right?
Right.
However, just like any other outer body part, it
Right.
needs care, right? So we should know this, but if we don't, let me just remind us, cotton underwear is the best underwear to wear. It's breathable, and it helps keep the vagina fresh, right? When
Right.
you're bathing, you should not be inserting your rag or inserting anything else to wash out or to clean out the vagina, because the vagina will push out the dead cells or whatever is up there to come out. It will push it to the outside. So all you have to do is use water or vagina-friendly washes to clean down there. Now, what I understand from the Yoni brand of products is that it is not just for self-medicating. You have the oils and the wash. Those are safe to use on a daily basis as long as you're not inserting them up.
Right.
Right? So, yeah, and that's basically it. You just need to assist your body in, getting rid of whatever has accumulated around the vagina. You don't need to insert anything if it is that you're not experiencing an infection or anything like that.
So if there is no infection, then it's fine. You just go ahead, continue to use your regular unscented soaps, preferably. And for women who masturbate, it's very important that you cut your fingernails. That we,
Right.
let me not say you, we cut the fingernails. No dirty fingernails.
Right.
And the other day I was on Instagram and I was reading a post. I don't want to call the page's name, but I was reading a post where the female was saying that she's concerned about her partner, when they have sex, him come inside of her every single time. And there was a particular healthcare professional, and they were saying, it's not safe for the male to be ejaculating in the female every single time, because what sperm does sometimes is throw off the pH. So you don't have to do it every single time. If you're gonna finger the female nails, if you're listening, cut your fingernail, please, and thanks. You don't want no dirt up in there. And the females, it's also important that you cut your fingernails too. It's safe to do that. Cut the fingernails and ensure that you're not inserting anything dirty up in there. One final question though before we go. In terms of vaginal steaming, there are herbs that are used, and I'm asking on behalf of the mothers who just gave birth. They tell us to use the Sitz Bath. I don't know if I'm saying it correctly.
Yeah,
Sitz Bath. For women who just gave birth, tell us what if there is an added benefit of doing the Sitz Bath, if it's okay not to, what is it? What is the Sitz Bath? Why we should be doing it? Is there something wrong if we don't? And does that interfere with the natural flow of how the vagina cleanses itself?
All right, so basically they recommend Sitz Bath for most of the time it's for women who went through labor, vaginal labor, and got a tear, or it might not be big, it might be small tears. So they recommend the Sitz Bath for women who have gone through labor and, might have gone through a little damage down there. So the Sitz Bath, I don't think nurses recommend Sitz Bath with these herbs that are being advertised. What I know is that Sitz Bath that is recommended. It is made of salt and water. So what the salt does, it will help to clean whatever injuries, whatever nicks, whatever cuts you might have experienced down there, and it will help to heal quickly, right? So the Sitz Bath is a good way to go. Nice warm water, nice salty warm water to get down there nice and clean and healed quickly.
So it's not recommended then to be using all of the herbs, all of the spices, all of the jibs and the jabs.
Especially not when you have just given birth and you may have some cuts down there, right?
Okay.
Yeah, so I wouldn't recommend that.
Well, this is where we have to go, nurse, unfortunately. But I really enjoyed having this conversation with you. If you did enjoy the conversation, ladies, you can always shoot me your feedback at sheknowsit.podcast@gmail.com or continue the conversation on Instagram, sheknowsit.podcast. The feedback is always welcome. Let me know what you think. Let me know, what you have been experiencing in terms of what the products you have used, how they have worked for you. Thank you so much for everybody who listens in from YouTube, as well as all other major streaming platforms such as Spotify, Deezer, Google Podcasts, Anchor FM, as well as Radio Public. So many of them. Thank you so much. If you're listening from YouTube, remember to like this video. Remember to share the video, comment and let me know what your thoughts are, as well as subscribe and share the link with all women who just may be interested in this type of conversation, this type of topic. Join me next week Tuesday, where we'll be having another riveting discussion on female issues. Thank you so much for joining me, Nurse Harris. Continue to take care of yourself. Yes, ma'am. Continue taking care of yourself and be safe out there.
Alrighty.
All right, bye.